Hello, everyone. A very warm welcome on behalf of Jehangir Hospital. I am Dr. Radhika Patil, Head of Physiotherapy and Rehabilitation at Jehangir. And today we are having this live Instagram session to celebrate World IVF Day, which is celebrated on 25th of June every year. And this day commemorates actually the amazing breakthrough that happened in 1978, where Louise Brown was born as the first baby conceived through IVF or in vitro fertilization. So this day basically serves to remind us of the amazing breakthroughs in science and medicine that we achieved at that time. And I have with me today a distinguished panel of experts here. I have for you Dr. Sachin Kulkarni, who is a renowned infertility specialist and IVF consultant with over 3 decades of experience. Sir has a lot of expertise in reproductive medicine and also treating complex infertility cases. Welcome, sir. I also have with me Dr. Sharayu Mohite. She is also an IVF consultant and she is known for her specialization in advanced fertility treatments and, of course, her compassionate approach to holistic patient care. Welcome, Doctor. Let's go immediately into the topic now. And I'd like to ask, how do you, or ma'am, either of you could answer this question. How would you actually evaluate a person if a couple holistically, and what all aspects do you consider when you're evaluating them for IVF?
Well, thank you so much, Doctor. And firstly, let's bow down and be humble to Professor Steptoe and Professor Edwards, who, after 19 failed attempts, they were successful in giving birth to Louisa Brown in 1978. And she also got pregnant and delivered. So IVF as a technology stands very tall today. And over 4 to 5 decades, the way the success rates of IVF has improved, and it has become one of the prime therapies of achieving pregnancies. And more than 1 billion babies world over have been born by now with this amazing technology. And we go across India, every nook and corner, you see IVF technology being practiced because the success rates are very high. And secondly, so many couples do need a faster pregnancy planning in their lifetime. Now, coming to the holistic approach, and that is the ethos and the core of Jehangir Hospital IVF Center, because IVF doesn't mean, or fertility treatments do not mean writing a prescription, because that's hardly anything when it comes to fertility treatment. It's about understanding, and it is we are listening to a couple which is an absolutely healthy couple. Otherwise, they're not having any bodily elements at all. They're not seeking any disease-free from us. Actually, they're just seeking, can their hope be fulfilled with us? So we give a lot of listening here to understand their issues very well, not only their elements regarding to the fertility part, but also with their sexual histories, with their diet patterns, with their lifestyle. Now, how disturbed is their lifestyle, the sleep cycle, etc. Then, what are the pressures they are feeling? We ask this a very proactive question to every couple who seeks us, wherein are there any stress of life on their own or family or societal pressures?
So all these things do
I think
matter.
they matter the most. They matter the most because they cannot express it in front of their elderly parents or in-laws because they feel why disturb them, and they can't freely talk about this in their company. Very few close friends would know about it, and even if these friends have children, they want this couple wants to be a little lonely from them. So this physical, this emotional aspect, I feel is very important, and we both concentrate heavily onto that. And many a times I get really touched when Dr. Sharvi is consulting and the couple just starts crying. I said, well, you really touch their heart, and that's why they're opening it up in front of you. The second aspect is, over a period of our practice, we have understood we won't need to practice this a little differently. We understand we have to analyze the female and analyze the male. but we are not treating only the female or the male, we are treating a couple. So we literally put, there is a classification system of male infertility. It's called Aphrodite classification. So we put it on the x-axis. On the y-axis, we have a Poseidon classification of female factors. So we put it on the y-axis. And we see which is the combination we have. Like, do you have an Poseidon 1 with an Aphrodite 3 or a Poseidon 4 with an Aphrodite 1? And
There are
yeah,
distinct
and so
categories.
this becomes very, very scientific. And these are the most recent datas. Like if our patients groups also, if they Google Poseidon group website, there will be huge data. The Aphrodite website is not yet formed. It's a very recent data published by Sandro Esteves from Brazil. But we recently happened to meet Sandro Esteves just about 3 months back. And then we learned this. This is the best way to make a combination and then put forth our treatment protocols. And that really goes.
So you mean to say that your treatment protocols will depend on which
What
category?
combination
Yeah,
we are seeing,
right.
and then that will decide, do we need to go hurriedly, can we go slowly, which investigation needs to be prioritized, how to explain them a success rate. We can't say blanket success, 30% or 40% or 80%. That will be so wrong, because these combination factors are the ones which determine therapy. So that's the way we are going nowadays, and that makes so much of sense. And we also evaluate very thoroughly a lot of factors which cause delay in fertility. For example, many times polycystic ovary is delayed diagnosis, endometriosis is a delayed diagnosis, low ovarian reserve is a delayed diagnosis, Mullerian abnormalities, adenomyosis. So we see to it that in our first consultation, all these things are ruled out. So we don't delay any further. I think that because one of the success parameters is time to pregnancy, and we need to give them pregnancy in a very short time. It's very essential to treat them as a couple and to prevent any delays in diagnosis, and that's what makes it sense to us.
Yes,
And
Dr.
to
Shah.
also add on that, whenever after this evaluation, which is anyways very common process for everyone, we always discuss the cafeteria approach with the couple. So we always tell them what are non-IVF options, IVF option, and your probability of getting a pregnancy without doing anything over next 6 months. And then obviously there are certain evaluation criteria where 3D ultrasound and certain parameters of the semen also we have to see and then take a call. So then it is very clear that if we go for expectant management without any treatment, the probability is like 10%, or with IUI it is 18-20%, or with the kind of evaluation we had, and after that whatever investigations we have done, and then whether IVF will help us to access it for time to pregnancy, because then they understand it better, because no there is no approach where it's 100% success. So it's always what we are fulfilling desire and not a diseased couple. So it's a good idea to give that approach to every couple, and then they choose. And that is what nothing but a holistic approach, even for treatment also, not just two parameters as such.
Right. And then if you have a couple with who has infertility but it's unexplained or you don't find any reason for it, then what is the relevance of IVF for them?
I think that's such an important thing and such a common practice to see couples who have investigated and they're not found a reason and they're really disgusted with it. We really don't know the reason, and
Very
yeah,
frustrating.
very frustrating. And they say, "Ki, no, I don't call it frustration, to be frank. I call it, these are the clients who are more focused on their treatment. Their whole aim is to get to a pregnancy. So certain realities are very hard to assimilate as a doctor in a society. And let me tell you those realities. You know, uh, the couples after 3 years of marriage, they're seeking a pregnancy, and the family members still keep pushing them. Oh, try it for one more year. Try it for one more year. So we really need to know statistically, or what is the chance of success if you're already tried for 2 years in the next year. So what literature says, the scientific data is very clear now with the advent of AI. It's becoming more, the data is getting churned so well. And we know for sure that in the first 6 months, when you're trying for a natural conception, if everything is normal, your chance of pregnancy could be anything around 15%. That's called fecundity rate. Over another, by 12 years, 12 months, okay, it just comes down to about 8 to 10% chance of pregnancy
So
after
it's
12
that
months.
steep
Yeah, after
then.
12 months of trying, where you don't have any problem. So there is some problem which the nature is not able to take care of it. And let's say down you go 24 months of natural conception planning, and now you're trying for a pregnancy over the next 6 months or another 1 year or whatever, your chance of pregnancy is hardly 5 to 6% per month. So your fecundity rate keeps on falling. Secondly, see, it is a town, sex also becomes a time bound activity by then, wherein the husband also says, "Ki, well, how many times I have to have sex on the 10th day or 14th day or 15th day to fulfill my this?" And every time it's a roller coaster ride, we go up and come down. So we very frankly tell the couples, you're an unexplained infertility. That doesn't mean that you are everything is normal with you. It just means there's something abnormal which we are not aware about. And we could be dwelling into it, like sperm DNA fragmentation, junction zone problems, chronic endometritis, finding minimal mild endometriosis, etc. So as we go in the depths of it, our unexplained infertility quota goes down and down. More and more patients come as explained. And there's no point diagnosing unexplained infertility for a couple who's beyond 35. That is age-related infertility, because beyond 35, the kind of embryos you produce are bad genetically, and the chance of pregnancy goes down. Now, put IVF here. So one has tried for 3 years, and she's trying for a natural conception in the fourth year with a measly chance of pregnancy of 5% a month. And now she introduces IVF. Your chance suddenly goes up to 60%. So I think this kind of a proper education is needed to not just the couple, everybody in the family, so that they take the right treatment and fulfill their dream. And how many months or years that lady should keep away from taking risks in her job, shifting jobs. She'll say, "Well, let me have a baby. I'll do everything later." They hold on to their careers. So how many years are you going to stretch that as well? So that definitely deteriorates the quality of a life for the couple.
No, absolutely.
That
And
makes sense.
emotionally,
Yeah.
it's really hard. Yeah. Yeah.
Yeah, one more. Yeah, you correctly. If the husband and wife age, this is again an AI churn data. If the age difference between the husband and wife is beyond 5 years, the husband is 5 years senior. In that case, as it is, the chance of pregnancy is 30% lower than any other
Oh,
couple.
really? I had
That's
no idea about that. Yeah.
Since the advent of AI, a lot of new data are churning up and
Wow.
a lot of information is coming up.
Yes, thank you, doctor. I'd like to ask Dr. Sharayu now. We always hear that IVF sometimes results or many times results in multiple pregnancies. So, suppose a couple would like to have only one child, then is that possible then to achieve through IVF? And what do you do then? How do you transfer only one embryo, or what do you do?
So this is a very common scenario what we are facing nowadays. Like previously, for Indian couples, they were always in a favor of having a twin pregnancy, because joint family, then carrying the baby and taking care of the babies would have been better, and in one go only the family would complete. But nowadays, from many the modern couples, and as everybody is having their career and all, many of the time, almost 73% of the time, the girl demands that I want to go for a single pregnancy. And then what is the best chance? Because in a scientific literature, what has been proven so far, if we transfer two blastocysts, means two embryos, which is of good quality, then your success rate is somewhere around 50 to 60%. But if you transfer only a single embryo, which is non-tested, which I'm talking about non-tested, then in that case, the result again goes down and it is around 30 to 40%. So that is why, everyone used
Better to
to
improve
practice
your chances.
we used to practice of transferring two blastocysts. But with invent of doing genetic testing of the embryo, what is called as PGTA. So where once the embryo is formed on day 5, we can take a biopsy of the embryo and we'll send it. And in Jehangir, we have this facility where we take the biopsy of the embryo and we chances of having twin pregnancy and everything is very, very low. And twins also have certain different complications. If there is a twin pregnancy, then there can be complications where there can be monochronic twin or only one baby getting good survival, or abortion chances are more. Then preterm birth, early delivery, these are more. So all this fear, and sometimes we have seen a couple where they have gone for two embryo transfer, got twin pregnancy also, but aborted, or some problem they face where they have to come out of the pregnancy. Now just imagine with IVF, you had twins and and then you went through all these things. So now with the invent of science, we should really go PGTA tested a single euploid embryo transfer.
So do you do that as a matter of routine?
Yes.
Okay.
And that is why, we have a very good success rate, because once we transfer single euploid embryo transfer, the success rate
Chances
jumps
are
to
very
75%.
high. Yes, yes.
So that is one of the key factor of having a single pregnancy, and that is boon for nuclear families are there more now to take care, and it's certain
Most
that
of the modern couples desire
desire one baby.
You know, they
So-
consider two baby to be a little difficult to go through as well. So
Yeah.
many of them do desire one.
Yeah, especially support systems are not
Yes,
as
yes.
strong.
So, rather than twins, we are getting nowadays more of this demand of going for only single. Then we give them option that you go for this testing. So, a chance of pregnancy, because now the approach of the couple is whatever we want to do best in the first cycle itself. Because these are all add-ons, the expenses and all. But then our success rate goes up.
Absolutely,
And
and then you can avoid multiple cycles.
Yes, yes.
I think there is one more situation very common nowadays that the couple always decides to have one baby. They have their baby naturally. The baby becomes now 7-year-old or 8-year-old and starts demanding a sibling. And the mother, out of her warmth and love towards the baby, says, "Oh wait, I think I should have one more go at it." By that time, the mother has become 36, 37-year-old, and getting a second baby becomes so difficult, and they definitely don't want twins. They're willing for IVF.
Yes,
Because they want to make more than themselves, they want to make the first baby happy. With having a sibling, and the baby relates to the siblings or the friends in the schools and colony, etc. So then the mother would like to have only one baby now because she already has one. So I think again here a PGTA tested single euploid transfer makes a lot of difference.
Yes, that's wonderful to know. And also, I'd like to ask either of you if it's a couple who's already nearing 40, then do you advise non-IVF or IVF treatment directly, or how do you go about advising people?
Yeah, so generally, when anyone crosses 37 years of age, then it's a advanced age. And what matters most is all about the oocyte competence, because it's not only the number goes down as the age advances, because it's a natural way of getting menopause at after 45, 50s. Anybody will attain menopause means the egg number goes down. That is a natural phenomenon. But what happens with the aging, that the oocyte competence of having abnormalities in the egg, that also increases. So if we have a data,
The quality of eggs is not as good.
so we produce maximum abnormal embryos as we go beyond 37 years of age. So even at the age, let's say at 40 years of age, the chances of having abnormal embryos at that period is around 60 to 70%, which is very, very high. Okay. And that is why, if somebody gets married late, let's say if somebody gets married after the age of 38 years and they're just tied for 6 months and all, then we have to make them aware that even though you are postponing your pregnancy because other parameters are good, she is ovulating every month and other, but this is one factor which we have to consider, that the embryo can be genetically abnormal. And that is why even in every month, the fecundity rate is why low, because we produce maximum abnormal embryos in human kingdom, not in lower animals, where they'll be having pregnancy only once in 6 months or once in a year. They'll have 10 puppies, 10 kittens, but no abortion in them, because nature has given them right to produce all genetically normal embryos, which is exactly opposite in humans, that we have a right to get pregnancy every month. But then in spite of all factors, we don't get pregnancy every month. Is only because of this, because we produce maximum abnormal embryos. And as the age advances, that incidence or that percentage of having abnormal embryos goes higher. So even the couple had late marriage, we have to consider this factor, that they have to try, the pregnancy time to pregnancy also we have to decrease. And then again, the PGTA, which we just discussed now, going to matter a lot, to have a genetically normal embryo transfer, which will increase their chance of pregnancy. And why at this particular age? Because as the age advances, it's going to go down, the number, quality and quantity both. So then chances of having their own genetic baby, that also goes down. Then we have to go for third party gamete, it's a donor gamete, which is very difficult for the couple to accept. So that is why Like at this age, it is advisable to go for IVF options faster compared to non-IVF option, just to have their own genetically normal embryos.
Right, that sounds very logical. I'd like to next ask you, what is AMH and why is low AMH so common in India?
It's AMH is anti-Mullerian hormone, and I think it's become a very day-to-day phenomenon known to all infertility couples by now, and all the doctors as well, right from general practitioners. So, anti-Mullerian hormone is a marker of quantity of eggs in the ovary. Okay, so somebody who has a high AMH has large number of eggs. Somebody who has less AMH, that means she has less eggs. So a typical combination in India is age advancing beyond 35 years and your AMH is coming down. So the AMH will till 25 years it peaks. From 25 years till menopause, the AMH is a slant decrease. But it's not a very typical curve or a particular axis it comes down. There can be an exponential fall in AMH, like somebody's ovary is removed, somebody suffers endometriosis, somebody just becomes obese, 90 kg, or somebody suffers from a rheumatoid disease or an inflammatory condition. Or has some tuberculosis or something, which is
Several things
yeah, there's several
actually.
things can be there which
Those
can just expedite the fall of eggs. When your body is inflamed, it can happen. And then that would give rise to a very low AMH. Now, this interesting question is why low AMH in Indian population? Rather, I would say low AMH is world over very common, right? The Society for Assisted Reproductive Technology SAR data of USA, when they put the data in 2021, was 62% of women who underwent IVF were having low AMH. So I think it's world over a phenomenon. But particularly in India, it is very important because there was a study published called SWAN study. It's a study of women across nations. That's called SWAN study. Wherein it compared the Indian women to the Spanish women. And they proved that Indian ovaries age 7 years faster than Spanish women. And let's say age of menopause in a woman who was born and brought up in London is 52 years, while that in India is 47. So we are 5 years earlier menopause. Now, I don't know whether it is the metabolic syndrome high, is it because the fertilizers which we have, the kind of pollution, or the kind of carbohydrate rich diets, let it be parathas in the north and idlis and dosas in the south and chapatis in the middle, all that, so much amount of carbohydrate and a long-term carbometabolic risk we contain, whether that is, or genetically we are predisposed to having a faster decline in our AMH is not known. There was a nice study published in Indian Express long back in Bengaluru where they analyzed about 22,000 women. And they said 12% of the women have menopause before 40 in India. That's pretty. So I think that has become AMH as one of the prime testing thing, because we want to know your ovarian reserve first, and then we can titrate our therapies accordingly.
right. Very, very interesting, and facts that not everybody knows. Um, and further, like to ask that so many people or even celebrities nowadays talk about freezing eggs because they want to have children later. So, how many years can an oocyte be frozen or vitrified?
Yeah, oocyte vitrification or embryo vitrification has become a absolute day-to-day thing. Formerly, the freezing technique was different. It was called slow freezing, and slow freezing was not very robust. But now the vitrification has been introduced over the last 1.5 decade. Now, this is a very robust technique. The survival rate is nearly 100%. Like in Jehangir, we use Kitazato medias, which come from Japan to us, and it has a survival rate of nearly 100%. We hardly have any embryo not doing well. It's very robust media, is a robust technique, and we have a team of expert embryologists, so they are very good in their performance. Uh, Oocyte preservation is mainly done for two reasons. One is women who are having cancers. Before they go for chemotherapies or radiotherapies or cancer therapies, they would prefer their preserving the oocyte so that they can use it in future. Or some social egg freezing, as you're saying. But I would say social egg freezing should not be the word used. Social egg freezing, it just puts it like an asterisk to but you have to be LA to freeze your eggs. No, that's not needed. Your daughter could be 27-year-old, but she is 100 kgs. her AMH is going to fall much, much faster than her friend who is 60 kg. And by the time she gets married by 32, she would have a low AMH. So she should go for an egg freezing now. And even if she reduces 20 kg, her AMH is still going to fall faster because it's a very tight binding of leptin concentrations in your body and AMH levels. If the leptin suddenly falls in sudden weight reduction, AMH also falls down. Now, this is not a fact known to many doctors as well.
No, because then
Yeah.
we need to raise so much awareness about this.
Absolutely. And so I feel, egg freezing in India should be a societal drive. Like, I always promote it to my orthopedic friends or friends who are doing rheumatology practice. I said, you see a lot of women who are having inflamed bodies because they're having connective tissue disorders. In Marathi, we call it Sandivat, all these long-term
Right.
chikungunyas and things like that. Or hematological friends who are having thrombocytopenias or some hematological disorders, which has a lot of inflammation in the body. So it's better we do a planned parenthood.
At least people need to be aware of what options are available to
But
them.
Jehangir Hospital will be the foremost to go to these people and speak to them the truth which exists there.
Absolutely, yeah.
And also, there's been I think 20 years later, they have used sperms which were frozen 20 years back, and then they could give a successful live birth baby. So vitrification has so much advanced. So the gametes or embryos can be stored for 15, 20 years without any harm.
Okay.
So we also had a case where for the testicular sperm, the semen was frozen, and after 12 years, when malignancy. So after 12 years, when he got married, then he came for those frozen sperms to use, and the wife is now pregnant of
Oh.
7 months. So
That's
science
something.
has advanced so much, and this vitrification process have done such a good for freezing of the gametes or embryos. So for the future perspective, it's really a boon in IVF, whatever so happened so far, that we can plan our future pregnancies in this better way of freezing.
So basically, that's what the advice you would give to a young people who don't immediately want a child. They've just got married or they don't have a partner yet, haven't found the right person.
Best is to go back freezing.
Yeah, and at times even we see that.
Don't you think this causes a lot of arguments between a typical mom
Yeah,
and
yeah,
daughter?
yeah, absolutely. It's
The
a
daughter says,
conversation.
well, I'm not willing to
Yeah.
get married now. And mom said, when will you have kids? So I think the easiest solution to this
Go
argument
for egg
would be,
freezing.
yeah,
Yes,
go for egg
everybody's
freezing.
happy. And
Everybody's
yeah,
happy.
so it is either you find partner, you don't find partner. That is a very good thing. As I mentioned about the medical conditions like endometriosis and all, even for these patients, we should offer egg freezing. Also, we could have a situation where we should offer them go for embryo freezing. A couple is having first baby which is autistic or mental challenge where it is difficult for them to plan a second pregnancy, which is very important because the first baby is already mentally
it's
or special
needed,
child.
yes.
So then in that case, they won't be plan immediately unless they have this baby
If
of
they
7 8
stabilize
years.
themselves.
But by that time, the nature is not going to wait. And the AMH is going to fall. For this couple also, they should go for yeah.
It's just of autistic first baby.
Right.
That
Makes
also
their
goes
AMH faster.
down.
Right.
Huge stress they suffer, chronic stress.
So
Right.
embryo freezing is option for that. Even oncofertility, where the wife is having breast cancer or ovarian cancer, and they want to go for frozen freezing the embryos now and then take the transfer later. So this is all advances where we can think of securing the pregnancy later, where we can have our own gametes which is used and having a healthy baby because you are doing it when your age is less than 35 years. So chances of having baby abnormality or genetic abnormality is very less. So that is advisable that you, and this is all because of the vitrification process what we have.
Okay, great. Also, now I'd like to ask you, for the last couple of years, we've heard so many successes at Jahangir in your department with people who have had a lot of failures before. So, how has this been possible?
Yeah, actually, I wouldn't say we've been just lucky. There's a huge amount of hard work put by the whole Jahangir team there.
I think a lot of diligence with what you do, how you do it.
I think like we got a lot of cooperation from our dietitians and our physiotherapy departments, or all the psychotherapists, etc., who looked into the holistic approach. And then we went very closely because we started an implantation clinic 3 years back. Implantation clinic is dedicated to only those couples who have had failed IVF first. And they need a completely relook at the whole case differently. Not just you did not do this in the first cycle, let's do this in the second cycle. That kind of approach is just not suitable. Rather, that poises them into a different problem altogether.
It's
They
like
need,
kind of playing root.
they need a complete relook into the whole case, and that's what we do at our place. And then we slowly look at the embryo part of it, and then we look at the endometrium point of it, and we have tied up with a laboratory in Bangalore who looks into the endometrial cytokines. So it tells us about the how the endometrium is inflamed, it's underinflamed, it's overinflamed, so we can pick it up and we can give them very tailor-made treatments. Secondly, we are also doing an HLA typing of the husband and wife, and that really gives us a clue about like what could be an HLA interaction between the husband and wife. Like for wife, when the husband's sperm and the embryo has husband's DNA also. So how that DNA is going to make an interaction, and will wife's endometrium respond to it adequately? So that can be measured, and now we are measuring that. And then we can type the embryo, we can select an embryo which can transfer. So trust me, we are going more towards single embryo transfers because we are getting more pregnancies with that. And with two embryos, we are putting a lot of other outside genetic matter to the womb to tackle. And will the womb be able to tackle it? So it's a completely different look. And this is a very important scientific way to go through it, because I see a lot of people just giving IVIGs and heparins and bar globes and this drug or that drug, left, right, center, without evaluating whether this couple needs that. That adds to the agony and also the cost of treatment.
So you're
So I think
basically pinpointing
yeah,
what is needed
absolutely.
and providing
And that
exactly
is
that.
that's actually the thing which is making a lot of difference to us. And if people have had one failure, then they have left their embryos in the labs, and they say, "Oh, we go through the whole cycle again because we understood this better now," and they've got pregnancies. So we're really happy about it.
Yeah, and also the way of how we do embryo transfer, like we choose natural cycle embryo transfer.
Very important.
So if you see that one question every IVF couple will ask the doctor, I have heard that IVF means lot of injection, lot of bed rest, and then how I will be able to do this. I don't want to go through all this trauma of taking injections, because I remember like one patient told that last IVF failure, I had 200 injections by the time I had taken, because as what sir mentioning, all these are injectables. But this is called as hormone replacement therapy. Like, we practice a natural cycle embryo transfer where naturally whatever the egg form, after ovulation of that egg, we transfer the embryo. So it is a natural cycle embryo transfer we call. So it has only one oral tablet and one tablet to put in the vagina. That's all. No injections at all. So it's an injection-free embryo transfer. What we do. So whatever patients we have considered, unless until they had menopause, where they have stopped the cycle, we don't do HRT cycle to anyone when they are menstruating every month regularly, or even in PCOD, we induce their ovulation and then transfer the embryos. So 90% of our whatever we have transferred the embryos, that is all on natural cycle embryo transfer. So patients are so happy they have not taken any injectable till they are going till 3 months, which is otherwise around. And cost goes down, because imagine with all these injections per month cost only goes 50,000, because they're taking so many injections. Again, we really don't know what will the future harm of those injections, which is like in the form of heparin, IV, urolin. We really don't know. So with this thing, minimal medications after embryo transfer, and we just ask them to go for only 2 days rest. That do not bed rest, just not move around out of the house for 2 days. That's all. It is also not needed. It is only for the emotional aspect part of it. But then because bed rest for that 10 days till the time you are getting result, it's very, very difficult. Everybody is so anxious about it. And when they have done a study like bed transfer after the embryo transfer and bed rest after the embryo transfer and versus not, they have achieved more pregnancies where the people have actually joined their offices and this thing, because your anxiety and the stress part also comes down. So that these both things we take care of as part of this thing. Another thing is, not every IVF failure needs another IVF.
Yeah, very.
So, there are many cases which we have handled over here. What has happened that there are so many IVF centers now. You must be knowing that there are 68 to 70 IVF centers in Pune itself.
Yes.
And because of that, it's what we call as conversion rate. So many of these IVF centers is having a conversion rate of how this infertile couple I'll immediately counsel and convert them to IVF. So you won't be surprised at the age of 25 years or 27 years couple already have one or two IVF, and that actually make them too depressed, because IVF is a last resort. And if that fail, what is next is their question. And they will be having that thinking, I will never achieve pregnancy. So the conversion rate is very fast. We really should know that whether we should go for IVF in first go itself. Obviously, there are certain indications where you should, because there are no other options like azoospermia, tubes which are blocked. And if they are taking treatment of one infertility for a longer time. But for every scenario, it's not that only you've been married at the age of 20 years and now you're of 27 years and it's been 7 years of married life and still you're not achieved, then you should definitely go for this. So you have to see holistically what we discussed previously, and then we have to go for this option. So we have so many patients where they have gone for IVF, but then either the dose was not given properly or the medicine what they have taken were not that adequate, so they had very less embryos. So what we practice in our clinic is to give adequate dose depending on their BMI, depending on their AMH, depending on their characteristic. So we face very less time that we got less oocytes or less embryo form. That is also one of the key of achieving success. So that we generally embark. And sometimes if she's having a very good ovarian reserve, then we should always give them a chance of non-IVF option. We have many examples where their first IVF is failed and now they consider either with natural or IUI cycle. So because we have told them that this is not a dead end, IVF is not a dead end. We have to think beyond that, that how we can improve our chance of natural pregnancy. And that just happens. There are people who just take a break of 6 months and take it natural pregnancy also. And that is mainly because of the stress factor has come down. And this we see very commonly, that first they go for IVF and next 6 months she's pregnant naturally, because all their stress and anxiety, everything goes off. They don't know when she's ovulating, when they're having intercourse and other things. So that's a very important aspect of, it's not IVF means not again repeat IVF. We have to see the couple holistically and then advise them the further things. And important aspect is a counseling also. So it's not about only giving treatment medically. It's also about counseling, because not every IVF is going to give a pregnancy. So we embark all this point that even if we do IVF, what are your positive points that you will achieve success? What are your negative points? And whether we can modify it, because obviously age we can't modify. There are certain factors which can't modifiable. But then how we can prevent all these things, that is a very important step before embarking IVF to any case or those cases with IVF failure. And that is what may be the good success rate of Jehangir Hospital.
Wonderful. Thank you for explaining so beautifully how you are, scientifically making this science so exact. You are making it less hit and miss, because so many times people just think, Are, hoga, nahi hoga, 50-50 chance. But then you are like really making it, pinpointing it, making it more and more explainable to people, raising awareness on it. But thank you for answering all those questions so wonderfully and giving so much hope to couples. So that is something really important.
That's all I'm doing.
Yes, yes. Thank you for being here.
Sure.
Thank you to all our audience. And I would like to end the session here today. Thank you.
Thank you.
See you all recording.